Most people don't realize this. Nearly half of home blood pressure readings are wrong just because of simple errors in technique. High blood pressure is the #1 risk factor for stroke, a leading cause of heart disease, and death. But here's the thing, you can't manage it if you're not measuring it correctly. And in this video, I'm gonna show you how to take your blood pressure at home the right way, and how to avoid the 7 most common mistakes, and get numbers you and your doctor can actually trust. Hi, I'm Dr. Brian. High blood pressure is often called the silent killer because you can feel totally fine while your arteries are taking damage every day. If you're doing home blood pressure checks but make small mistakes, your numbers can be way off. And that can lead to unnecessary medications or missing if you need medications and that you have a serious problem. Well, let's fix that right now. Here are the most common mistakes people make and exactly how to avoid them. Mistake #1, not resting before you measure. Let's say you just walk the dog. You sit down, slap on the cuff, and you hit start. Boom, 152/92. Your heart skips, panic sets in. But what if I told you that number might be totally wrong? If you're taking your pressure right after you climb stairs, you're rushing around walking dogs, carrying groceries, your reading can spike by 10 to 20 points. Always sit quietly for at least 5 minutes first. Let your body settle. Let your heart rate go down. Let your blood vessels relax. That way, the reading reflects your true baseline, not your body in go mode. Mistake #2, using the wrong cuff size. Using the wrong cuff size is extremely common, especially with store-bought monitors, because most cuffs sold over the counter are medium or standard size, but many adults, and probably most adults, especially those with large or muscular arms for any reason, actually need a large cuff. And here's the fix. You just measure your arm. Use a soft tape measure, wrap it around your upper arm, that's right between your shoulder and your elbow, right in the thick portion here, and you match your measurement to the correct size: small, medium, or standard, large, and extra large. Because keep in mind, a cuff that's too small can actually raise your reading by 10 to 15 points, and that's enough to turn a normal number into a scary one. Mistake #3, bad sitting posture. Sitting on the couch, legs crossed, slouch forward, feels relaxed, right? But during blood pressure reading, posture really matters. If your back isn't supported in a firm chair, your core muscles tense to hold you upright. This can raise your systolic pressure by about 6 to 10 points. Remember systolic, the upper number? Crossed legs, that restricts blood flow to your legs, and that increases the resistance in your blood pressure, and that can raise your pressure by 2 to 8 points. How do you fix it? Pretty straightforward. Get a firm chair, not a soft chair or the couch. Keep your feet flat, put your back against the chair, and then relax. Mistake #4, you hold your arm not at the heart level. Here's something most people overlook: arm position. If your arm is way below your heart level, gravity increases the pressure. If it's way above, gravity lowers it. And this is an easy fix. Prop your arm on the chair or table, a pillow, so it's level with your heart. Imagine a straight line from your heart to your cuff. That line should be flat. Mistake #5, caffeine, exercise, or smoking too soon. Just had a coffee or squeezed in a workout? Don't take your blood pressure yet. Caffeine can raise your systolic pressure by 5 to 10 points, especially in sensitive people. So can nicotine. And exercise? Definitely. So try and wait at least 30 minutes after caffeine, after smoking, or after working out, so your reading reflects your usual state, not a short-term spike. #6, talking while you're taking your blood pressure reading. It seems harmless, chatting with your spouse or taking a phone call, but even light conversation gets your nervous system revved up. Your heart rate ticks up, your blood vessels constrict, your pressure rises just a little bit. Talking, even quietly, can raise your reading by up to 10 points. So sit still, breathe quietly, and save the convo for afterward. Mistake #7, taking only one reading. A lot of people take one reading and they call it done. That's like throwing a dart and based on that single dart throw deciding I'm a champion or not. The smart strategy, take 2 readings at minimum each time, at least a minute apart, and do this twice a day, morning, evening, before meds, before food. Keep a log or use the automatic download to your phone, which is available for almost all of the modern monitors. Then track that pattern over 7 days. That'll give you and your doctor a real picture, not just a lucky or unlucky moment. And a reminder, don't just measure when you're feeling really poor, stressed, or unwell. That will likely just show you spikes in your blood pressure, not your real baseline. So here's what I want you to remember. Blood pressure only helps if it's measured correctly. Use the 7-step method above to get numbers you can trust. And remember, don't let one bad number ruin your day. Track the trends, not individual measurements. If you ever had a scary high number at home and freaked out, you're not alone. Drop it in the comments. If this video helped you, hit like, subscribe, and check out my other video, 10 ways to lower blood pressure naturally, or how to choose a blood pressure cuff. Thanks for watching. Stay smart, healthy, and I'll see you in the next one.